Hi, everyone. I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to Monday Q&A. This is a place where I answer your direct and specific questions as long as you're not asking me things I can generalize to everybody. If you do have a question for me, please make sure you leave it below in the comment section, or you can email directly to me at info@drzphc.com. As always, I picked randomly 6 questions from the Q&A folder in order that they first came into me, and I have blocked out everybody's names for privacy reasons. And there's going to be timestamps below on each one of the topic in case if you want to jump around. So having said that, I'm excited. Let's get started. Let's see what the questions are. And the first one came every time the questions come in from email and I screenshot them. It's really small font, so bear with me. Here, there we go. Hello, Dr. Z. First of all, I would like to thank you for all the free content you provide with your videos and blog. You are so welcome. They have both helped me a lot. I started my social transition, she, her, with my friends and peers online mostly, and I've never been happier. Originally, I was planning to wait to start HRT and other medical treatments until I grew out until I grew out my hair and had at least a semi-passing femboys. I've been on a hair regrowth treatment and have been following trans voice lessons videos on YouTube. That's a great YouTube channel for those of you who don't know. Trans voice lessons, it's a great resource. The problem is I've been balding for years and used to be a heavy smoker and feel like I'm not making fast enough progress for myself. I also feel like I hit a wall and I'm starting to feel like an imposter. I've always wanted too much of my life. I already wasted too much of my life lying to myself and others about who I really am, but I'm afraid I don't check those 2 boxes before starting my medical transition. I can't expect people to see me as a woman. So I'm assuming those 2 boxes for you would be hair and voice. I'm afraid to get backlash hate with the current political and social climate. If I start medical transitioning before I'm passable, hate that word, but I don't know how much longer I can wait. Yeah, I hate the word passing too, and I think a lot of you do too. It's a pressure from society to adhere to particular gender way of looking. I would love to hear your thoughts on when to start hormones and the healthy reasons to start or wait. Thanks again. Sorry if you already covered this independently. I haven't. It's a topic all on its own. I haven't made it through the whole back catalog yet. Hope you have an amazing day. Hope you have an amazing day too. This is a fantastic question. So what do you do when you have started social transition, when you have come out like this person has online, maybe in a privacy toward your friends, to some really close acquaintances, and when you started to do some small things like working on your voice and also doing something to help you with the hair regrowth if you're struggling in that area, if you have sustained some early baldness, if you will, or hair loss, what to do, especially if passing matters to you, or if you're concerned about passing. If you're concerned, remember, passing is not for everybody. If you are especially worried and you do want to be able to pass, and you do feel like the voice and hair is a big part of it, and you haven't started hormones yet because you just want to see how all of this is going to pan out, what to do in this scenario and when to start hormones. Here's my opinion. My opinion is that hormone treatment for dysphoria is not only there to modify secondary sex characteristics, it is first and foremost there to alleviate psychological distress. It is incredible how many people express to me when they do start hormones, how much more at peace with themselves they feel. And I have a lot of clients who are only on hormones without moving into any kind of surgeries. Yes, all they do is they take the hormones and that's it. And that helps them alleviate dysphoria and distress, and not maybe to the extent where it's completely goes away. And they still struggle with their physicalities, they do. But they're okay. So this is the choice and decisions they made because they feel like transition at this point in their life is not something for them. So my question to you when it comes to hormones is, do you think the hormones can help alleviate the psychological distress? And I would bet my money that it probably is. I would definitely give the hormones a try. Another thing that I see happens all of the time is when people such as you who wrote this beautiful question, such as you, put so much emphasis on passing and being able to look good and so much emphasis on how your voice sounds and how your hair looks. But when you do start actually feeling better, and you oftentimes don't start feeling better unless you're actually having the right hormone in your body also. When you do start feeling better, it is amazing how suddenly those things that you emphasize are still important, but perhaps you're not so concerned about them. Perhaps they're not as important to you, or perhaps you're just not pressured so much by them. So again, I think it's really important to for anybody who's struggling with dysphoria for a long time to really try the hormones and see even if hormones in of itself are going to be enough to alleviate distress. Where if you feel like you're not ready for a surgical transition, you don't have to do it. So that's what I would recommend. I know that you're just waiting for that just to make sure that it's almost like you're looking for the hopes that you will pass because passing matters to you and you don't trust that other things are going to fall into place. And I think a lot of people are going to tell you that they struggled with the same thing. And they're going to tell you that for them it was also scary and difficult to move forward, but they did. And they feel so much better as a result of it. So I would actually consider hormones at this point, to be honest, and not as a gateway into the whole blown surgical transition, but as a gateway for psychological ease of mind and alleviation of dysphoric distress. So that's what I would recommend. That's a really good question, and I wish you all the best. Question number 2. Hi, Dr. Z. I really like your videos. I have a question. I've started feminizing hormones, and then you're putting down some of your, so you're on 50 gram estradiol and you're not taking any blockers. Okay, 2 months so far. Identify, basically, this is totally fine to be on estrogen, not taking any kind of blockers in the form of Spiro or in the form of bicalutamide. It's very, very common. There's no one way to have your hormonal regimen. Your medical doctor will adjust it just specifically for you. And a lot of people choose not to be on the blockers. If those of you are wondering, because people say, well, if you're feminizing, why would you not want to do something to reduce the testosterone levels? It's because people also want to be able to maintain their sexual life, and testosterone is important for their sexual life. Identify as non-binary, and or because there you go. Also, it doesn't fit with your gender goals in terms of your gender identity. And I plan to be on hormones for the rest of my life, and every change so far has been positive. However, I still literally have no clue about what my gender even is, more specifically the non-binary. Is this okay? I'm pretty much I've pretty much just embraced the fact that my gender is just one giant cloud of confusion. So yeah, I'm diagnosed with dysphoria, I'm on hormones, that's been great, but I still identify as a giant non-binary soup of confusion. Thanks. You are so not alone. Gender is already one giant soup of confusion. Many, many people are confused even when they're on hormones. It's easier for people who identify as trans-binary. What I mean by that is trans man or trans woman, and they know exactly what they're looking for. They know exactly what they want to get out of the hormones. It's easier for them, and it becomes more clear. When you identify as non-binary and you identify as any other, forget even non-binary, you identify maybe like as a genderqueer, or even if you prefer no labels at all, but you're still trying to figure out what gender means to you. And sometimes there's no even language to help you figure out what gender means to you. It can be really challenging and difficult. The important thing here, I would say, is pay attention to how things make you feel. So it looks like hormone makes you feel great. You already confirmed it to yourself, right? That they make you feel great. But yet you don't know exactly maybe on gender spectrum you fall. You think you're non-binary, but specifically non-binary what? Well, how about just non-binary? How about that just for right now? How about just right now, instead of trying to figure out, just to sit with what feels right and what feels comfortable. And if hormones feel right and feel comfortable, how about just sitting with it? A lot of times we chase labels, and it really doesn't help us much. So it's better to be here in the now. Another thing to remember is that not everybody's gender identity is stable, is fixed over duration of time. For some people, their gender identity is fluid, it's mutable. You may right now enjoy the feminizing effects of hormones and how they make you feel, and you think you're gonna be on them for the rest of your life, but you never know. Maybe your identity is more mutable, and maybe in 6 months things are going to change, and you're going to decide to be off hormones for some time. So allow that for yourself. To allow the fact that as human beings, we constantly evolve, we constantly grow, we constantly change. We're never, ever, ever static. I'm not the same woman that I was yesterday, believe it or not. I definitely not. Things have changed. There's things that came into my sphere of influence. My perspective on some things has changed. Um, so allow yourself the room for that, the room for sitting with the unknown and being okay, and just sitting with, instead of having the language to know, sitting more with how you feel. And that would be my advice to you. And that would be my advice to anybody. It's so important for us to sit with how we feel. A lot of times we get too stuck in cerebral sphere, trying to name everything, trying to dissect everything, trying to understand everything. And sometimes we just need to feel things for ourselves without even needing a way to define it. So that's what I would recommend for you. It's a really good question. Question number 3. Hi, Dr. Z. My question is, what do you do when your endocrinologist dismisses you from the office due to a lack of communication? And no matter who you call, they say we're not taking new patients. What I do? Thank you. Oof, this is a unfortunate one. I'm sorry this has happened to you. I think that in this case, I would recommend to seek another medical professional to work with, especially if they continue to refuse to see you and they're saying they're not taking any new patients. There's really, I mean, there's like no action as far as I know you can take, because providers have a right to refuse to work with certain people, to refuse to, and it doesn't make it right or wrong. It just is. And some endocrinologists, just like any other people in your professions, there's some people who are in my profession, there's some people who are, you name it, you store clerk, you mail person. Some people are just maybe not the most mindful types of individuals. I don't know what exactly happened between you and a crowd. Sounds like lack of communication, but if they're refusing to see you, I think the route of less resistance is going to be to try to seek another medical provider that you can establish a relationship with, that is receptive and that is interested in working with you. So that's what I would recommend. I know it's right now, and just not even right now, but in general, it is always hard to find a good endocrinologist. But I'd rather be seen by somebody who's less experienced, but who's willing to see me and wants to work with me, than to see somebody who is refusing to work or see me, or just, acting in this way. So that's what I would recommend. And I wish you all the best. Question number 4. Does gender subject line, does gender dysphoria stay all the time? Message. Hi, I've been having some discomfort with my body, like questioning as to why I was born male and what I dislike about it, and like I came to conclusions I don't like it. I don't like my facial hair, body hair, and even other things. While this feeling is here today, it might be gone tomorrow and then come back that very night or in a few days. I felt this way since looking more into what it means to be transgender, because I know now for about 20 years, now off and on, I've often half wished I would wake up as a girl the next day and really want to be a girl. Okay, so I would so your question is, does gender dysphoria stay all the time? No, it doesn't. It fluctuates, just like you experience it fluctuating. And the fluctuations in of itself are also significant. Fluctuations can tell us a lot of things. Fluctuations can mean also a lot of things. Your gender dysphoria can fluctuate because perhaps there's more fluidity, like I said to the question, I think it was question 1 or 2, there's more fluidity, question number 2, there was more fluidity to your gender identity, and that's why it fluctuates. It could be fluctuating because you're constantly going in and out of states of mental coping with it, where some days you just do more of an avoidance in order to not to feel it. Maybe you employ some other defense mechanism. So the fluctuation can also, tell you quite a bit And it's a matter of observing that fluctuation. The important thing with the fluctuation is it consistent and persistent? If it is consistent over duration of a time and it persists over duration of a time, that's pretty, even though it fluctuates, that's still, if we were to line it up on one of the charts, I don't know what it's called. One time I did a video talking about this chart and one of you pointed out it's like scatter plot, I think. And then if you were to line up where the scatter plot is going, if it's all leans in one direction, well, that's an answer. It's all leans toward dysphoria. So yeah, it's definitely fluctuates. If that fluctuation gives you a lot of confusion about your gender identity and you don't know what it is, I always recommend seeking support of a local therapist who can work with you and who can help you figure out the pattern and what your fluctuation is telling you about you and your relationship to gender. So that's what I would recommend. That's a really good question. But yeah, it fluctuates. I think I even have a video on dysphoria fluctuating on this channel as well. Question number 5. Sorry, let me get a sip of water. I've been recording content today for all of you. So when I do it, my throat just loses itself. I should probably be drinking hot tea instead. Question number 5. I'm 24-year-old, assigned female at birth, and I've come out as non-binary and just started my social transition this year. My question involves bottom dysphoria. I've never been able to enjoy receiving oral from partners, no matter how comforting and considerable they try to be, and have only reached climax once, when I couldn't see them. However, all other contact with my genitals is fine, and I don't experience any discomfort with being the female in the situation. I also notice that it seems lessened when I'm with another assigned female at birth, and then if I'm with bisexual assigned male at birth. I'm constantly comparing myself and their male partners. Is this normal thing for non-binary people? Thank you so much for all you do. You're very welcome. So let me skim your question over again. So you're 34, you are non-binary, you're assigned female at birth, and you started to transition. Okay, and you've never been able to receive oral from your partner, so that's probably makes you uncomfortable, no matter how comfortable or considerable they are. And let's see. All other contact with your genitals is fine. I'm assuming during sexual intercourse, all other contact with your genitals is fine. You don't experience discomfort. You also notice that it lessened when you are with another assigned female at birth. And if you are with a bisexual assigned male at birth. Okay, so, and you're constantly comparing yourself to their male partners. Okay, so you mentioned you're assigned female at birth, you're non-binary, and you haven't told me if it's non-binary, non-binary masculine, non-binary feminine. I am making a big leap of assumption it's non-binary, leaning toward masculine, because you mentioned that you compare yourself to their male partners. And a lot of times when I have clients who experience genital dysphoria only during intimacy, and when they experience a genital dysphoria because they're also comparing themselves to male partners, meaning they're comparing their genitals and they feel like they have lesser than because they don't have a penis, and because they have a vagina, it makes things very dysphoric and very uncomfortable. And suddenly there's something about even genital organ, not to mention we live in society that not only genders our genitals, but it gives very strong sexual emphasis on our genitals, and in a very, very, very specific gendered way. Vagina, for example, is a genital seen in society as an organ that receives. It's on the receiving end. It's something that needs to be penetrated. All of those words are immediately associated in our society, at least culturally, with women, even though vagina is not the only organ that can be, or body part, I should say, that can be penetrated, right? A person can also be penetrated by their anus as well. There's an oral sex involved. So But there's something about particular this body parts, vagina and penis, that creates a lot of dysphoria for people, especially for non-binary folks. I see this a lot too, and for trans people who have not had genital surgery, who feel comfortable with their genitals otherwise, but when it comes to intimacy, suddenly the dysphoria goes up through the roof. One of the reasons why dysphoria goes up to the roof is because you are comparing yourself to their male partner. So you're comparing yourself to being an individual that does or does not have a penis. But it also could be that, you have certain personal associations to what vagina is. And you could have a strong, this is again assumption, but it's possible that you could have a very strong association that vagina equals I am a female. And you don't identify as female. I know that you already said you don't identify as a woman. So it could be that you're having that strong association that if somebody goes down on you and in order to give you oral sex, immediately it may feel to you viscerally. It puts you in this place of femininity, which is not something that you're in alignment with, and it can bring up all of these dysphoric feelings. So what I usually recommend for people is I recommend for people to work on their narratives, their headspaces, learn narratives about what all those things mean and what they're for, and learn how to create a healthier paradigm shifts and healthier ways of understanding and relating, because these are again body parts that we as human beings gendered. A body doesn't really gender itself. It's we who assign all this meaning and all the things. So that's what I really recommend, to move away from it. But the dysphoria when it's in intimacy like this can be very uncomfortable. You mentioned that you feel less of dysphoria with assigned female at birth and with bisexual assigned male at birth. Another option to recommend is, while you're working through breaking down these paradigms inside of your headspace, to make sure that the intimacy you have are with people you're more comfortable with, such as the people you have mentioned. So that way, as you're working through this, you also, through the intimacy, through being sexually open, you're working through bypassing that when you're intimate, and that's going to solidify all of it together and make things that much more, it's going to help with all of those things. So that's what I would recommend. It's a great, great question, and it's a very, very common one. I had a question, I don't know how many videos ago, somebody asked, they were assigned, I believe they were assigned female at birth, identified as transmasculine, and they had no genital dysphoria except during sexual intimacy, and their sexuality was toward men or masculine individuals, and that's when it would spike up with them too. So it's again, it's something that does happen. So those particular encounters, especially in intimate spaces, will make us that much more aware and put us in a particular proximity to our bodies and any other scenarios we have going on. So great question, and hopefully that was helpful. And our last question for today, question number 6. Hello, Dr. Z. I'm 21 years old, non-binary person, and I really love your content. Your videos have been really helpful in educating and informing me, and I just began social transition. You are so welcome. It's also wonderful to see a lot of non-binary folks asking questions. That's really great. I wanted to write to you regarding my relationship with the online queer community. I began to avoid a lot of trans spaces on social media and reduced my activity to real-life queer groups and more intimate, smaller online communities. Reason why is because I see a lot of negativity and pessimism on both online platforms and queer news outlets, and it can really bring my mood down. I understand that this is an unpleasant time for a lot of people, and there are times when I get really upset at the state of things, but I still believe that things are overall better for us now. I agree, compared to even a decade ago. I agree. But no one seems to acknowledge that. I totally agree. I think it's very common for human beings to focus on the painful negatives that is right in front of them, than to acknowledge and to move, or to contrast and compare to other times. Personally, I've doom scrolled a lot in the past in regards to transphobia and bigotry, and it's only brought me misery and depression. So I've decided that I don't want to live like that. Good for you. When I see trans person online being all pessimistic, I tend to avoid them. Am I wrong for thinking this way? I don't want the situation to be due to internalized transphobia. No, you're not wrong in thinking about that. I don't see this as internalized transphobia at all. You're not avoiding to see other people's content because they're bringing up internal transphobia in you. You're avoiding to see their content because it is negative, it is pessimistic, it tends to focus on all, and it's okay to focus on negative things, but when people focus on negative things all the time, it can pull you down. It is depressing. It is amazing how quickly it can affect your mood. It is amazing how quickly it can really affect your state of well-being. It doesn't take much and it becomes like a vacuum, right? You get sucked into it and you are now in the space. And before you know it, you keep staying and staying in that place. So this is not wrong for you at all. Right now, I highly recommend for people to, in general, to really minimize how much social media they're using and to be very discerning which social media outlets all of you using. Right now, I really recommend for everybody, myself including. I mean, lately I had to really limit myself. I used to every morning check comment section because I make sure I comment on all the comments under videos, not the shorts that I do because it's just too much. And I had to do it now only 2-3 times a week because it's too much. I'm getting way too more negative comments on my channel, and it's affecting my day. And I know it's nothing compared to the negativity all of you getting, but I'm just using that as an example. So right now, for all of us, it's really, really important if you're going to be on social media, be very discerning who you're choosing to watch, who you choose to listen to. Either listen to trans non-binary people who are positive, progressive, um, carry out advocacy, who are strong, who are motivational, who make you feel affirmed, who make you feel heard, who make you feel optimistic versus pessimistic, or follow people who are allies in this field, who also make you feel all those things, or follow people who are not even in this field. Follow people who are motivational speakers like Tony Robinson. Is it Tony Robinson or Robbins? I love the guy and I don't even know his name, but you know who I'm talking about. I do. I have like a few motivational people that I follow. Sometimes when I listen too much to it, it becomes a little bit like, okay, I got it. But at a right time, you sometimes just need that. You need a mix and composition of that. So you're not wrong. I don't see this as internalized transphobia at all. I see this as boundaries and taking care of yourself. That's how I see it. And I see it as being very, very prudent. And prudency is exactly what all of us need. Great, great question. And yeah, I would advise you to continue to do that. And I generally try to walk away from negative people in my life because I just don't have time for it. And it's not worth it. Negative people, they suck energy out of you. It's just, they're like energy vampires. So comment below, let me know what you think, share on other people's questions, what are your thoughts, what your feedback. I know that everybody reads comment section and become kind of like a supportive network here for all of us to share. Comment below, again, share your input, and I will see you all next time. Bye.